what is neuropathy? Neuropathy is a really misunderstood condition, and unfortunately, it is a condition that a lot of patients don't have solutions for when they see their medical doctor. Now, typically, what's given, if you go to the medical doctor, they're going to prescribe you a course of medication known as either gabapentin and Neurontin, and those medications are really anti-seizure medications. So what happens is, why as a neuropathic patient or a neuropathy patient are you getting this medication, is what it's essentially doing is slowing the signals down from your brain to the rest of your body so you don't actually feel what's going on. So by definition, neuropathy is a condition where the nerves aren't functioning the way that they're supposed to. Typically it presents itself with balance problems, numbness, tingling down into the legs. It's typically in the older population. However, I see it as young as 30 years old. Now what happens is you can have neuropathy that's chemotherapy induced. So somebody who's gone through cancer treatment, unfortunately, what happens is with the chemotherapy, usually you end up causing damage to the nerves, and now we have to address or re-stimulate the nerves so that they can function better. Another one is alcoholism. Alcoholism is another one that damages the nerves. Another one, the most common one, is diabetes, right? So diabetes is the most common cause of neuropathy, where the symptoms are burning, numbness, tingling into the legs, feet. Sometimes it was called as restless leg syndrome, but that's an inaccurate diagnosis. Again, the one that bothers me most with this is difficulty walking, because people will start to shuffle because they can't see their feet. They might cut their foot and not realize it because they don't have sensory component of that nerve, so their feet can't usually feel the floor. If they cut themselves, they might get some type of infection, and that's when you start to get gangrene sets in, and that's a bigger problem. So we have a lot of adults that have this, and they come to us specifically for it. Now the question is, can chiropractic help with it? It is not a typical chiropractor that can treat this. We use a lot of different tools in our office to deal with it. We address the nutritional component because we've got to deal with it if it's a diabetic. We have laser therapy that we use in here. We have PEMF, which is called pulse electromagnetic fields. If there's a stenotic component, meaning if it's coming from the spine, some people get neuropathy as a result of spinal compression or disc herniation, or better known as also stenosis. We'll use a table that's called a decompression table that opens up the spinal segments. So depending on the particular condition, how the patient has neuropathy, what kind of neuropathy they have, depends on what we're going to do in our office. So I wouldn't say any chiropractor can treat this. It is a specific chiropractor that has specialized training and really the specialized equipment to deal with this condition, because it really does challenge the quality of life. People suffer with this condition, and it's one of those things that people suffer needlessly and quietly. So it's quality of life is what we work for here. And with a neuropathy patient, one of the things that they tell me right away is, hey, I can walk better, I can sleep better, I can play with my grandkids, I can walk with my husband or my wife again around the park, or I can go on vacation. Okay, pre-COVID, that was a big one for people, as their goal was to go on vacation with their family, and they're unable to go because they're that uncomfortable. So it's one of the things that we really focus on, because again, quality of life is ultimately our goal.